Most people never think about their kidneys until something goes seriously wrong. And that's understandable. Your kidneys are quiet organs. They don't demand attention the way your heart does when it races, or your lungs do when you feel short of breath, or your stomach does when something you ate doesn't agree with you. They sit silently in the background, tucked under your rib cage toward your back, doing their work hour after hour, day after day, with almost no recognition. But make no mistake, they are among the hardest working organs in your entire body. Every single day, your kidneys filter enormous volumes of blood, removing waste products, balancing fluids, regulating sodium and potassium, helping control blood pressure, activating vitamin D, supporting red blood cell production, and maintaining the chemical stability that keeps every other system functioning properly. They are not just filters. They are regulators, coordinators, and stabilizers. And when kidney function starts to decline, the effects don't stay confined to the kidneys. They spread everywhere. Your energy changes. Your fluid balance changes. Your muscles, your skin, your sleep, your blood pressure, your heart, even your brain can all begin to feel the consequences. That's what makes kidney disease so dangerous. Not just the damage itself, but how quietly it develops. Chronic kidney disease often begins gradually. In many cases, early changes cause few dramatic symptoms. The warning signs can be subtle, easy to dismiss, and surprisingly ordinary. People explain them away as stress, aging, poor sleep, dehydration, standing too long, working too hard, or just one of those things. And that is exactly why so many people are diagnosed late. By the time kidney disease becomes obvious, a significant amount of kidney function may already be lost. The good news is that early kidney disease is often detectable. In many cases, it can be slowed significantly, and sometimes the factors driving it, especially high blood pressure, diabetes, excess salt intake, obesity, smoking, and certain medications, can be managed before irreversible damage accelerates. But that only happens if people recognize the signs early enough to act. So in this video, we're going to walk through 7 early warning signs that your kidneys may be struggling. Not 7 random symptoms from an internet list. 7 signs that actually make sense when you understand what the kidneys do, how they fail, and how that failure begins to show up in everyday life. For each one, I'll explain what may be happening at the physiological level, why this symptom matters, and how to think about it without becoming unnecessarily alarmed. Because let's be clear, none of these symptoms on their own prove kidney disease, but they can be clues. And when several clues appear together, especially in someone with diabetes, high blood pressure, cardiovascular disease, obesity, a family history of kidney disease, or long-term use of certain painkillers, those clues deserve attention. Your kidneys may be quiet, but they are never completely silent. If you know how to listen, they often start sending signals long before a crisis happens. So let's start with one of the most overlooked signs of all. 1. Persistent foamy urine. Almost everybody has noticed foamy urine at some point, and in many cases, it means very little. If you are dehydrated, if your urine is highly concentrated, or if you urinate forcefully into the toilet, you may see bubbles or foam. That can be completely normal. The key issue is not occasional foam, it's persistent foam. Foam that appears regularly, foam that lingers, foam that looks thick or soapy rather than disappearing quickly. That can be an early sign that protein is leaking into your urine. To understand why that matters, you need to understand how the kidney filter works. Each kidney contains around 1 million tiny filtering units called nephrons. Inside each nephron is a structure called the glomerulus. a network of very small blood vessels designed to filter blood with incredible precision. It allows water, salts, and waste products to pass through while retaining blood cells and, most important, proteins inside the bloodstream. One of the most important proteins the body tries to keep is albumin. Albumin is not supposed to spill into the urine in meaningful amounts. When it does, it often means the kidney's filtration barrier has been damaged. That damage can happen for many reasons: diabetes, high blood pressure, inflammation, autoimmune disease, obesity-related stress on the kidneys, or other underlying kidney disorders. When albumin leaks into the urine, it changes the surface tension of the liquid, and that can create a persistent foamy appearance. So the foam itself is not the disease. It's a visible clue that the filtration membrane may be leaking. And that matters because protein in the urine is more than just a sign of kidney injury. It can also contribute to further damage. The parts of the nephron downstream from the glomerulus are not designed to handle large amounts of protein. When they are exposed to that protein day after day, inflammation and scarring can worsen over time. This is why persistent protein in the urine is taken seriously. It often means the kidney is injured, and it may also mean that injury is continuing. Now, not every person with kidney disease notices foamy urine, and not every person with foamy urine has kidney disease. But if the foam is persistent, especially if it's happening most days, or it's accompanied by swelling, fatigue, changes in urination, or high blood pressure, it deserves evaluation. A basic urine test can check for protein. If that is positive, your clinician may order a urine albumin to creatinine ratio, blood tests for kidney function, and sometimes repeat testing to confirm whether the problem is persistent. This is one of the earliest and most useful signs because it can show up before someone feels particularly unwell. And that is exactly why it should not be ignored. 2. Swelling in the ankles, feet, or lower legs. The second warning sign is one that many people explain away as heat, travel, or standing too long. And yes, sometimes that explanation is correct. A little ankle swelling after a long flight, a long shift, or a very hot day can be completely harmless. But persistent swelling, especially if it becomes frequent, noticeable, or progressively worse, can be a sign that the kidneys are struggling to manage fluid and salt properly. There are two main reasons kidney disease can cause swelling. The first is related to the protein loss we just talked about. Albumin doesn't just stay in the bloodstream for no reason. It plays an important role in keeping fluid inside blood vessels. Think of it as part of the force that helps hold water where it belongs. If albumin levels drop because protein is leaking into the urine, fluid can start moving out of the bloodstream and into surrounding tissues. Gravity then pulls that fluid downward. That's why swelling often shows up first in the ankles and feet. The second mechanism is sodium retention. Healthy kidneys constantly adjust how much sodium and water they excrete. When they become damaged, they may start holding on to more sodium than they should. Water follows sodium, so retaining more sodium usually means retaining more fluid. Over time, that extra fluid volume contributes to puffiness, swelling, and sometimes rising blood pressure. This kind of swelling is often called edema, and the pattern matters. If you press gently over the swollen area and it leaves an indentation for a few seconds, that's called pitting edema. That finding is not specific only to kidney disease. It can also happen with heart failure, liver disease, certain medications, or circulation problems. But it is a sign that fluid balance is off and should not be casually dismissed. Kidney-related swelling may be mild at first. Shoes feel tighter. Socks leave deeper marks around the ankles. Rings become harder to remove. By evening, the lower legs feel heavy. In more advanced cases, swelling can move higher up the legs, and fluid may also start to show up in the hands, face, or around the eyes. The important thing is persistence. Occasional swelling after obvious triggers is one thing. Regular swelling that is becoming your new normal is something else. If you're noticing this repeatedly, especially along with foamy urine, high blood pressure, fatigue, or reduced exercise tolerance, it's worth getting checked. Because swelling is not always just a circulation problem. Sometimes it's your kidneys telling you they're losing control of the body's fluid economy. 3. Fatigue that feels deeper than normal tiredness. Fatigue is one of the most common symptoms in medicine, which also makes it one of the easiest to ignore. People blame work, poor sleep, stress, parenting, age, low mood, overtraining, undertraining, and life in general. And to be fair, sometimes they're right. But kidney-related fatigue often has a different quality to it. It feels heavier, more persistent, less responsive to rest, less explained by what you did the day before. One reason for that is anemia. Your kidneys do not just filter blood. They also produce a hormone called erythropoietin, or EPO. EPO signals the bone marrow to make red blood cells. Red blood cells carry oxygen. So if kidney disease reduces EPO production, your body may start producing fewer red blood cells, and anemia can gradually develop. That means less oxygen is delivered to tissues throughout the body. Your muscles fatigue more easily. Your brain may feel foggy. You may get winded with activities that used to feel easy. You may sleep and still wake up feeling drained. And because this process usually develops slowly, many people don't realize how much their baseline has changed. They adapt. They lower expectations. They start planning around their fatigue without fully noticing that they are doing it. This is what makes kidney-related anemia so easy to miss. There isn't usually one dramatic moment. It's a gradual narrowing of energy, a shrinking of capacity, a sense that everything takes a little more effort than it used to. Now, fatigue in kidney disease is not caused only by anemia. Waste products that should be cleared by the kidneys can also accumulate and contribute to malaise, poor appetite, brain fog, and generalized low energy. Sleep can be disrupted by itching, leg cramps, or repeated nighttime urination. All of those factors can combine. So when someone says, "I'm just exhausted all the time and I can't explain why," kidney function is one of many things worth checking, especially if other warning signs are present. A simple blood count can look for anemia. Kidney function tests can assess creatinine and estimated glomerular filtration rate, often called eGFR. Additional blood work may help determine whether anemia is due to kidney disease, iron deficiency, blood loss, inflammation, or another cause. The important point is this: persistent fatigue is common. But common does not mean meaningless. If your energy has changed in a sustained way, and especially if it's accompanied by swelling, foamy urine, sleep disruption, or risk factors for kidney disease, it's worth looking deeper rather than simply normalizing it. 4. Waking up repeatedly at night to urinate. Let's talk about a symptom that many people assume is just a bladder issue or part of getting older. That symptom is nocturia, having to wake up at night to urinate. Now, once in a while, especially if you drank a lot of fluid late in the evening, had caffeine, or had alcohol, waking once to urinate may not mean much. In older adults, one trip some nights can be fairly common. What matters is the pattern. If you are waking multiple times each night, if the problem is getting worse, if you are producing significant amounts of urine overnight, or if this change is relatively new for you, kidney function becomes one possible explanation. Healthy kidneys don't handle fluid the same way all day and all night. At night, the body normally shifts toward producing less urine. Hormonal signals help the kidneys conserve more water while you sleep, which allows most people to rest for longer stretches without needing to empty the bladder. But when kidney tubules are damaged, that ability to concentrate urine can weaken. The kidneys may stop responding as efficiently to the hormonal signals that would normally reduce overnight urine production. As a result, they produce more dilute urine during the night, and the bladder fills again and again. That's one reason kidney disease can lead to frequent nighttime urination. Another reason is that impaired kidneys may be less efficient at handling salt and fluid throughout the day. And fluid that accumulated in the legs while you were upright may shift back into circulation once you lie down. That fluid then becomes available to be filtered, increasing nighttime urine production even more. So, nocturia can sometimes be the result of both poor urine concentration and altered fluid distribution. Now, it's important to be balanced here. Not every person who urinates at night has kidney disease. This symptom can also happen with diabetes, enlarged prostate, sleep apnea, overactive bladder, certain medications, excess evening fluids, heart failure, and other conditions. But kidney disease belongs on the list, particularly when nighttime urination comes with other signs: swelling, foamy urine, fatigue, high blood pressure, or abnormal lab results. If you are getting up 3, 4, or 5 times a night, that is not something you should simply accept as inevitable. It fragments sleep, worsens energy, increases fall risk, and may be the visible tip of a much deeper metabolic problem. A urine test, blood pressure measurement, blood sugar check, and kidney function tests can help clarify what is going on. Because when the kidneys lose their ability to match urine production to the body's needs, your sleep is often one of the first places you notice it. 5. Puffy eyes, especially in the morning. This is one of those signs that people often dismiss as lack of sleep, allergies, too much salt the night before, or just aging. And once again, sometimes that's exactly what it is. But persistent puffiness around the eyes, especially if it is most noticeable in the morning and happens alongside other symptoms, can be a meaningful clue. The skin around the eyes is thin, delicate, and very good at revealing fluid shifts that might go less noticed elsewhere. That's why mild fluid retention often shows up there early. If the kidneys are leaking protein, blood albumin levels may fall. When albumin falls, fluid is less effectively retained inside blood vessels and more likely to seep into tissues. Because the tissue around the eyes is loose and soft, it's an easy place for that fluid to collect. And since you are lying flat during sleep, fluid redistributes more evenly through the body overnight rather than pooling mainly in the legs. By morning, the swelling may be especially obvious around the eyelids. This is called periorbital edema. The pattern is often symmetrical. Both eyes look puffy rather than just one. That distinction matters because swelling in one eye alone is more suggestive of a local issue, such as irritation, trauma, infection, or inflammation. Kidney-related puffiness often improves as the day goes on, and gravity pulls fluid downward. But as fluid retention worsens, that morning puffiness may become more persistent and may appear alongside swelling in the feet, ankles, or hands. Now, as always, context matters. Puffy eyes can happen for many reasons. Allergies can do it, lack of sleep can do it, crying can do it, sinus congestion can do it. So this is not a symptom to interpret in isolation. But if someone has puffy eyes in the morning, plus foamy urine, ankle swelling, rising blood pressure, fatigue, or known diabetes, that cluster becomes much more significant. This is one of the reasons clinicians never focus on a single symptom alone. Medicine is pattern recognition. One clue may mean very little. Several clues pointing in the same direction are much harder to ignore. If you are repeatedly waking up with facial puffiness that doesn't fit your usual pattern, especially if it's new or persistent, it may be time to ask whether your kidneys are part of the story. 6. Muscle cramps, especially at night or at rest. The sixth warning sign is one that doesn't seem kidney-related at first at all: muscle cramps. And yet, the kidneys play a major role in keeping the muscles electrically stable. Your muscles contract and relax based on carefully controlled signals involving sodium, potassium, calcium, magnesium, and phosphate. These electrolytes have to stay within a very narrow range. Too high, too low, or poorly balanced, and muscles and nerves start misfiring. Healthy kidneys constantly help regulate those levels. When kidney function declines, that precision begins to break down. Potassium may rise. Calcium and phosphate balance may become disrupted. Magnesium can shift. Acid-base balance may also change. And when that internal chemistry moves outside the normal range, muscles become more irritable. That can lead to cramping, twitching, weakness, or a feeling that muscles are more likely to seize up without much provocation. Now, everyone gets cramps from time to time. Exercise, dehydration, prolonged standing, pregnancy, certain medications, and just plain bad luck can all cause them. But kidney-related cramps often have a few characteristics that make them stand out. They may happen more often at rest. They may wake you from sleep. They may come alongside fatigue, swelling, abnormal urination, or itching. And sometimes they are accompanied by tingling, numbness, or even palpitations if electrolyte imbalance is more significant. This matters because electrolyte abnormalities are not just uncomfortable. They can be dangerous. Severe potassium disturbances, for example, can affect the heart. Significant calcium and magnesium abnormalities can influence muscle function, nerve function, and rhythm stability throughout the body. So if cramps are becoming frequent, unexplained, or unusually severe, especially if they are happening together with any of the other symptoms we've discussed, they should not be brushed off as just getting older or not stretching enough. A metabolic blood panel can quickly check many of the relevant electrolytes, along with kidney function. And if the problem turns out to be kidney-related, management is not just about treating the cramp. It's about correcting the internal imbalance driving it. Because sometimes a muscle cramp is just a muscle cramp, and sometimes it's chemistry. 7. Persistent itchy skin without an obvious rash. This final symptom is one of the least expected and one of the most frustrating. Itchy skin. Not a visible rash. Not mosquito bites. Not eczema flaring in one small area, but a more generalized, persistent itch that seems hard to explain and hard to relieve. This can happen in kidney disease, especially as kidney function declines, and it has several possible causes. One is the buildup of waste products in the blood when the kidneys are no longer clearing them effectively. Those substances can contribute to inflammation and alter the way nerves and skin respond, creating a sensation of itch that is real, distressing, and often difficult to treat. Another factor is mineral imbalance. The kidneys help regulate calcium, phosphate, and vitamin D metabolism. When that regulation begins to fail, changes in parathyroid hormone and mineral balance can contribute to skin symptoms, including itching. Dry skin can make things worse. Even though someone may be retaining fluid overall, the skin itself can still become dry and more prone to irritation. And in some people, there may also be a neurological component. The nerves themselves become more likely to send itch signals even without an obvious external trigger. What makes kidney-related itching so miserable is that it often doesn't behave like ordinary itch. Moisturizers may help only a little. Antihistamines may do very little. There may be no obvious rash to explain it. And it often gets worse at night, interfering with sleep and steadily wearing down quality of life. Now, again, balance is important. Most itchy skin is not kidney disease. More common explanations include dry weather, allergies, eczema, soaps, detergents, fungal infections, contact irritation, liver problems, medication reactions, and other skin conditions. But when the itching is persistent, generalized, hard to explain, and appears with other kidney-related signs, it deserves investigation. Especially if a person already has risk factors like diabetes, high blood pressure, cardiovascular disease, or known abnormal kidney tests. This is one of the classic examples of how kidney disease doesn't always feel like a kidney problem. Sometimes it shows up in the skin, sometimes in sleep, sometimes in energy, sometimes in swelling. The kidneys are central regulators, so when they struggle, the symptoms can appear almost anywhere. Why these 7 signs matter together. Now here's the most important part of all this. These symptoms are not random. They reflect different jobs the kidneys are supposed to be doing. Foamy urine may reflect damage to the filtration barrier. Ankle swelling and puffy eyes may reflect protein loss, sodium retention, and fluid imbalance. Fatigue may reflect anemia, toxin buildup, or poor sleep from other kidney-related symptoms. Nocturia may reflect a loss of urine concentrating ability. Muscle cramps may reflect electrolyte and acid-base imbalance. Itchy skin may reflect waste buildup, mineral disturbance, nerve irritation, or skin dryness linked to kidney dysfunction. In other words, each symptom tells a different chapter of the same story. The kidneys filter, the kidneys balance, the kidneys regulate. And when those roles begin to fail, the body starts showing evidence of that failure in visible and sometimes surprisingly ordinary ways. The mistake people make is waiting for something dramatic: severe pain, severe illness, an obvious medical emergency. But chronic kidney disease often does not begin dramatically. It begins quietly. And it is often discovered not because of one shocking symptom, but because someone finally pays attention to a pattern that has been building for months or years. Who should be especially alert? Some people need to be extra vigilant because their risk is higher from the start. That includes people with diabetes, high blood pressure, a family history of kidney disease, heart disease, obesity, a history of smoking, older age, frequent use of anti-inflammatory painkillers like ibuprofen or naproxen, autoimmune diseases, previous kidney infections, kidney stones, or urinary tract problems. If that sounds like you, these symptoms matter even more. Because in a higher-risk person, subtle changes are more likely to mean something real. And the earlier kidney disease is found, the more options there usually are. Blood pressure can be tightened up. Blood sugar can be improved. Protein in the urine can sometimes be reduced with targeted medications. Dietary sodium can be lowered. Weight can be addressed. Smoking can be stopped. Nephrotoxic medications can be reviewed, and progression can often be slowed, sometimes significantly. That is the whole point of early detection. Not panic, not fear. Action. What should you do if you notice these signs? If you recognize one or more of these symptoms in yourself, the answer is not to self-diagnose kidney failure. The answer is to get checked. A basic evaluation is often straightforward. It may include a urine test to look for protein or blood, a urine albumin to creatinine ratio, blood tests for creatinine and eGFR, electrolytes, a blood pressure measurement, sometimes a blood count to look for anemia, and, depending on the situation, blood sugar testing, imaging, or referral for further evaluation. These are not exotic tests, they are routine, and they can reveal an enormous amount before symptoms become severe. That is why ignoring early clues is such a missed opportunity, because the window between subtle warning signs and major kidney damage may be longer than people think, but only if someone actually opens that window and looks. Final message. Your kidneys are not asking for attention because they enjoy drama. They ask for attention because by the time they are screaming, the damage is often advanced. So listen when they whisper. Listen when the urine becomes persistently foamy. Listen when your ankles swell for no good reason. Listen when your energy drops in a way that rest does not fix. Listen when you start waking again and again at night to urinate. Listen when your eyes are puffy in the morning and it's not just a bad night's sleep. Listen when your muscles cramp for no clear reason. Listen when your skin itches and nothing seems to explain it. None of these signs alone means your kidneys are failing, but each one may be a clue. And clues matter, especially with a condition that is common, often silent, and far easier to slow early than to treat late. That is the difference between prevention and crisis, between preserving function and chasing loss, between catching the problem while you still have room to act, and discovering it when the options have narrowed. So if these symptoms sound familiar, don't ignore them. Don't normalize them too quickly. Don't assume they are just aging, stress, or one of those things. Get them checked, because healthy kidneys protect almost every system in your body. And protecting them early may protect far more than your kidneys alone. It may protect your energy, your independence, your heart, your blood pressure, your sleep, and your future. Your kidneys may be quiet, but they are talking. The question is whether you are paying attention.